Hello, good afternoon, or good morning, wherever you're at. Welcome to the National Native Network webinar series on cancer risk reduction in Indian country. This webinar is titled Bringing Tribal Cancer Plans to Life. Today, your presenters are Kerri Lopez, Eric Vinson, and Antoinette Aguirre, I believe. Kerri Lopez is the director of the Northwest Tribal Comprehensive Cancer Project. Eric is the project coordinator, and Antoinette is the cancer prevention coordinator, and they all work for the Northwest Portland Area Indian Health Board. The learning objectives of today's webinar are share idea. By the end of this webinar, you'll be able to share ideas for tribal cancer prevention activities, describe a process for tribal cancer implementation, and understand tribal communities' diverse interests in cancer. And now I will hand it over to the presenters.
Good afternoon, everyone. This is Kerri Lopez. And I know we have a title that we want to be a little bit of a mystery, so we're going to go through and share programs here in the Northwest. And I titled this Bringing Tribal Cancer Plans to Life because those of you who have your strategic plans sitting on your shelf and your cancer plans and your nutrition plans, what we really hope that we're going to have you walk away with today is some ideas of how to do some cancer prevention activities in your tribes and kind of on a shoestring budget. So Eric's going to talk in a little bit more about how you apply for our little implementation funding. So I'm going to start out by giving a little information on our organization. We're from the Northwest Portland Area Health Board, and this is a map of the 43 tribes that we work with here in the Northwest. And as you can see, kind of a big area. I always like to open with our organizational chart because we are a 638 contract. We're a tribal organization, and we're an Indian health board where every single one of our tribes is a member of our health board. So our little chart here shows our executive committee on top, and then our director, Joe, the epicenter. But I always kind of like to point this out because everything we do here in the Northwest is truly governed by our tribes. We take everything to our quarterly board meetings. All the projects we work on are passed in resolution at the meeting. And also our tribal leaders bring forward projects they want us to work on. So we really, truly work for our tribes. So if I have any Northwest tribes out there listening, hello, bosses. So then you'll see that our program falls under the National Epicenter. And we are also part of the National Native Network. We're one of the partners. And I realized that we failed to put Intertribal Council of Michigan where the project's housed. Then there are our partner organizations, CRIB, South Alaska Regional Consortium, the Great Plains, and Northwest Portland Area Indian Health Board. So here's our objectives, and Josh talked about them earlier, but I also like to share I am a member of the Talawa tribe in Northern California. So the picture on the right is my grandmother. She passed a few years back, but this was a Curtis photograph that was taken as close as we know when she was about 16 or 17. And it was right before we no longer could practice our religion. So there was a generation that skipped. So that's Ada Richards. And I like to start with that because that's my own history. So we're going to share some tribal cancer prevention activities today. Eric's going to go over what we call the Tribal Cancer Plan implementation. So those of you who have grants also know, we used to call these mini grants, but CDC, because they're small, they don't want that term anymore because of all the documentation. So they're local cancer plan implementation now. And then we hope to give you a little bit of an understanding of the different communities because when you saw that map, our Northwest tribes are very diverse, not just in culture and language, but also we have our smallest tribe is 96 members, and then We have Colville and Warm Springs and Spokane that are much, much bigger.
11,000.
Yeah, about 11,000, our biggest tribe. So we have a lot of different communities we work with here. And I really feel that they have been very creative, and I hope you're going to find that by the time we're done here today. One of the things that made our grants work or our programs work is the tribes are able to do what they want. So we have a lot of different projects that go on out there in our community. So our tribes work with youth, they work with the elders, work with family. We have, in the last few years, seen a big increase in nutrition and physical activity that we really love. Tobacco's been going on a while, and also sun safety, which was a new one, and Eric pushed very hard, I think, trying to get that out into our communities. So we have one of our youth programs that 1 year with their funding got visors and sunblock and water for staying hydrated, so it was a focus around being safe in the sun. And then a little more traditional for screening, we have programs that have done breast and cervical cancer over the years, and you'll see some of those also. But we have several programs that have done women's health days, where there's the mobile MAM comes in, the primary care providers do scheduling. They try and make them fun and rewarding. So a lot of the programs will have gifts for the women. They'll have a massage therapist there. They'll have nice creams and lotions, and often give a gift certificate for the women who come in and take care of themselves, because we all know that it's hard to make time sometimes for ourselves. And then we also have done a lot with our colorectal screening, because we have Kiki, our inflatable colon, and Kiki has gone out to many, many tribes in the last few years. We had a little naming contest, so I really like that we ended up with Kiki, because one of the staff here said it kind of sounded like a stripper name, but I was like, well, that girl gets around, so it's apropos that Kiki ended up the name of our colon. And then, of course, we have a number of tribes that have survivor groups, and over the years we've had bigger groups, smaller groups. We're going to talk a little bit about one of our very successful survivor programs here in the Northwest. But again, our tribes have been very, very creative. So we have walks, we have powwows, there's support groups, honorings that happen. One of our tribes early on worked with American Cancer Society and did res runs. So they were very involved with ACS and partnered. And
so to give you a little background, thought we'd look at the tobacco use here in Oregon as well as nationally. And this slide kind of speaks for itself. You can see that nationally as well as in Oregon, the non-Hispanic white smoking rates as reported by Burpus are pretty similar. And you can see a confidence interval there on the national numbers. For Oregon as well as nationally, American Alaska Native rates are significantly higher. Oregon a little bit higher than the national average, and obviously various areas within the U.S. have varying rates of smoking. But within Oregon, we're at about 35.3. So the impact of that really, you can look at a number of different things, as we learned with this last year's Surgeon General's report. But if we look at lung cancer, we can see that the incidence in Oregon is statistically significantly higher for American Alaska Natives at 84.6 per 100,000. And the end result of that is we also have a higher mortality rate. So there's the Oregon rate there at 68.6. And then nationally, there was a report done this last year for American Alaska Natives, and you can see that's 55.2. So the unfortunate reality is, even amongst those and the nationally, we have higher mortality, but then we also have that higher mortality in Oregon. So talking about the actual cancer plans and how that works. So our grant fiscal year for the Northwest Tribal Comprehensive Cancer Program starts July 1. So for us, we're really busy kind of getting the year started. So when it comes around fall, winter time, we send out our applications to the tribes. And that really kind of works well for some tribes that may be planning things beginning part of the year, maybe for colorectal cancer awareness month or cervical cancer awareness. And then that we have it rolling. So if a tribe wants to kind of apply earlier, we encourage that. If there's a great idea that comes around, or maybe a person in a position that wants to apply for something a little bit later, they can. And we put April as the deadline because really, you know, around April, you're looking about 2 months until our June 30th end date. And at that point, you know, you've got a very short lead time to plan things. So the tribes that have applied earlier, you know, they've got the funding, they've got their activities planned. But those have kind of maybe procrastinated a little bit. We have that deadline to kind of help to spur the applications to be submitted. So as I mentioned, our project wraps up June 30th, so we ask for the projects to do that. So that's the end of our fiscal year, and then we ask as part of the project that they evaluate and report on it. So this year, we emailed out. Most people have email nowadays, which is pretty handy. And so middle of October, we emailed out, and then we also discussed it and disseminated print versions at our coalition meeting in November. So this is all, you know, about 6, 7, 8 months before our end of fiscal year. So there's hopefully sufficient lead time to go through the processes that are necessary to get approval for application and submission. So we also reach out to tribes kind of starting in the new year. We call, basically, in addition to talking about our upcoming activities, encourage people to apply and have that discussion about what people are interested in doing and what's meaningful for their community. So in terms of the application, we have our request for proposal, and on the front we've got the CDFA number, and if any of you have worked with federal auditing processes, you'll know that any of the funds you get, you want to know the CDFA number. So we've added that in more recent years so that that can complete the process for the tribal finance departments. And then we have a really nice little action planning worksheet, and I'll get to that in a couple later slides. And that's really simple, but it really helps lay out everything. And then we give some references. So one is example activities. So there's like a little paragraph description of the different activities that different tribes have done, kind of spur the thought processes about things that might work for a given tribe's community, or you know, they get inspired and think of something new. We also have an example proposal because really, you know, it can kind of be scary if you're not a grant writer to write these sorts of things. And I'll mention briefly that this whole application process is designed to be as easy and accessible as possible, because the reality is these mini grants, or these implementation funds, excuse me, are $3,000. So the amount of paperwork you want to have for a $3,000 amount of funding relative to, you know, a $200,000 amount of funding should be proportional. So what we've asked for is the cover letter on letterhead, and then for it to have gone through whatever appropriate processes, as well as the action planning worksheet, which I'll show you, and it's pretty straightforward. And we've also got an action planning worksheet kind of filled out along with the proposal. And then very importantly is our 20-year plan objectives. So there's the Comprehensive Cancer Control Plan for the region, and in there we have a number of objectives addressing all those things that Kerri had mentioned. And we really want to connect what tribes are doing to that plan so that we can both demonstrate how our program's having impact in the area, as well as supporting the tribes in a meaningful and structured and well thought out manner. So here's the letter that went out middle of October, and I put it in here kind of as an example of, you know, the cover letter from the tribes could be really straightforward. I mean, this is on our letterhead. It's got a signature here. It's, it's describing what's in the application. And so we really are looking for this on letterhead to make sure that it's a legitimate application from the tribe and that it's gone through the appropriate processes to be submitted. This is our worksheet, and so this is sourced from a 88 publication, the Executive Guide to Operational Planning, and it allows a person who maybe hasn't really written down what they've done before to write those steps down and to identify the person who's going to be principally responsible. And it may be one person does almost everything, or if you're working in a team, you'll want to have the people that are working on each specific element to be identified, so that later if there's an issue that you can go to that person and say, hey, you've committed to doing this, this is the thing that you're supposed to be doing. And then others, because of course a lot of times, if you're talking about maybe setting up tables for an event, you might have the organizer, but then you'll have a whole crew of people working on it. And schedule, because it's always important to have idea in mind about when you should start and stop things, so the planning doesn't happen after the event, or silly things like that. But just writing it down can help to structure your thoughts and put together a plan for a successful event. And then of course resources. So they've got some funding from us, but then there's also potentially some other expenses, and they may be coming up with those funds from other tribal health programs or other entities, and to identify how much time is going to be involved so that you have an appropriate amount of resources for it. So if it's, like I mentioned, maybe setting up tables 30 minutes before, you've got a handful of people to go do that. And then what sort of feedback? So typically that's in the form of like a survey to the participants. You've got your programmatic measures as well as satisfaction, and then in some cases you can look at maybe referrals out to colorectal screening or breast cancer screening, or as Kerri was mentioning with the some of those screening days, you've actually got numbers of people screened. So as far as who's doing this, so within the tribes, we have our delegates, our health administrators, or health directors, the social workers, nurses, community health representatives, cancer survivors. Basically everyone you can think of from a tribe is involved with these activities. And as far as programs, they come from a wide variety of programs. So there's not, as you may be aware, tribal cancer projects. So there's not funding from IHS or the federal government to help support individual tribes having cancer navigators or others working on to address cancer. And so we've got people that are coming from community health, the maternal child health. We've got a couple of maternal child health nurses that are very much involved with our program and have written grants. Of course, tobacco programs in Oregon and Idaho, we have tobacco coordinators. Unfortunately, in Washington, they've defunded all the tribal tobacco coordinators, so we don't have them to work with. But in Oregon, Idaho, there's colorectal cancer staff within some of the member tribes. We've got a couple navigators that are funded through tobacco programs. There's some of the traditional foods programs. As Kerri had mentioned, nutrition has really come to the forefront in the past few years. Behavioral health, some of them are working on tobacco cessation, and then we also had a number of the community transformation grantees we'd collaborated with. In terms of partners from outside of like tribal health, of course there's support from tribal council, casino. I mean, a lot of the programs will use the casino printers and make up some really nice glossy posters. There might be some support from tribal enterprises, like some of the tribes that have water bottling and can get some water for the events and things like that, as well as the usual like Komen and ACS. USDA has been a partner in terms of some of this nutrition work. The CDC-funded state breast and cervical cancer projects, as well as some of the tribal breast and cervical projects. Some local universities have brought in expert speakers or some expertise to really support these activities. So whether it's nutrition expert or maybe a pharmacist who can speak to, erectile dysfunction issues for men who've had prostate cancer treatment, that sort of expertise that can be drawn from local universities and colleges, as well as local cancer centers. So some of them have supported tribes by having a booth or maybe with some sunscreen for some of these activities that are outdoors and many of those sorts of things.
So we're going to talk about a couple of the programs that they've all been successful, but we're going to highlight a couple of programs. And I would like to add, Eric does a lot of work getting the tribes to get these grants done, and he has also been a speaker at several of their prevention activities, so I wanted to give Eric a shout out because he's gone in and done some work when the tribes have these events. So I really appreciate that, and the tribes appreciate it. And the other thing is we're really trying to get some resources back to our tribes. $3,000 is not very much, but part of the reason we do it like that is you don't have to document it then and do it as a contract. So it's kind of the magic number for contracting, and we can do it as local implementation and not have to go through setting up contracts. So we're hoping we make it easier. If someone from CDC's out there listening, when you up our grants to $100,000, we can get a lot more back to the tribes and we'll contract with them. So shout out for more money. Always have to do that. But this is a men's golf retreat that came out of one of our tribes. We have a very good working relationship with the health educator that was up there at the time, and she really was trying to get her men in for just hearing about cancer and cancer education and prostate and colon cancer, and called and said, so I'm thinking I want to do a golf tournament. It was like, okay, we can do a golf tournament, but it has to involve trying to reach out. So Krista was very creative in putting together a program where there was education that happened on the holes out on the golf course. Little cards were put on the greens, and then as part of it, there's a luncheon where they have a keynote speaker that comes in every year and talks about colon cancer, prostate cancer, whoever they can get in as an expert. So she did a really good job of really making it work, and she has done it for a few years now, as you can see. And each year it got bigger and bigger to the point where now the men at the tribe are like, so when is our golfing tournament happening? So I really thank her for hanging in there, and I think other tribes have done it. In the meantime, I hope you'll take this away. Maybe this is one of the ways to reach your men. But again, you can kind of look at over the years, they started with 8 men coming, and now it's up to 20 men that come and play in the golf tournament. One of the other things there on the bottom, we have the outcome. One of the other things that Klamath did, and this is actually not part of the men's health, but they had very high smoking rates and weren't doing very much with it, so they created a program to, it was a competition with the providers at the clinic, and it was basically they were referring to the quit line, but between a provider and her medical assistant, they had a 600% increase in referring people to tobacco cessation. So that was just one of the other successes that happened with Klamath. So we are very proud of them and what they did up there. And just as kind of a sidebar to that, when we did some of our BRFIS work with them, that also showed in the BRFIS, the quit rates for that period when they were doing the provider competition. And again, talk a little bit about men, because I don't know what's with you dudes, but you guys are hard to reach out there. So one of our other tribes wanted to do a men's wellness day, and they really did a great job. Eric talked about those partnerships. They made it, they partnered with the tribe, they partnered with industry. The tribe gave folks time off during the day to come over to the event. Very well coordinated. They had great gifts for the men. They did drawings all day long. and they had all of their different departments that came in. So their police department, the fitness, chemical dependency, the WIC program, women's health, tobacco, maternal child health. They really all pitched in and made the day successful. And you can see the little thing at the bottom where there were 114 participants last year. And then this is one of our tribes who actually has a tribal cancer coalition. So from that day, they got 10 men that joined the Tribal Cancer Coalition. And also, this is one of we have 114 participants there, but when they started doing this day initially, I think they started with 30 participants, and over the years it's grown. And they do, every other year, they do a men's wellness day, and then the next year they do a women's wellness day. So they've had, again, huge success, and Eric Scana participated in this one. And for my Northwest tribes again, he's very helpful. If you don't have him as a speaker, he will help set up and tear down and be very active and a part of it. And then this is the third one I'm going to talk a little bit about. And again, this is one of our tribes who had a breast cancer support group, and they worked very hard getting women to their group and having speakers and presenters. They did a dinner, and I think the big kind of shout out here is for the tribe. They have a social worker and a nurse case manager who have part of their job is doing this cancer survivor group for their women with breast cancer. So there's 15 women in the group now, but what also happened, and the outcome here, is they have another staff member, another nurse, who's now doing a cancer survivor group for all cancers, because they had a lot of folks come in that were not breast cancer survivors, but other cancers saying, we feel like we want the support, you're doing a great job. We've heard very positive things from the women who come to your group. So this particular tribe now has a group for all other cancers. And they're very active in the coalition. We really appreciate their input. And I know that one of the things that they've really loved, one of our resources we developed here in the Northwest is a patient navigator appointment companion, where you can track your doctor's appointments and your meds, and they love our appointment companion, and we appreciate that because they've given us a lot of positive feedback. And I think on that, our hit-up batter is Antoinette. So that's not the right term. What do you call it? Cleanup batter.
Cleanup hitter.
Antoinette's cleaning up today, and she's going to go into depth talking a little bit about one of our Oregon tribes. But I did want to say that for us here in the Northwest, the tribes in Oregon have been working with the state of Oregon through the Oregon Health Authority since 1994, and that's when we worked to pass the tobacco tax, and Oregon at that time committed funding to the tribal programs just like they did the county. So the tribes here have been working with the state since 1994, so I wanted to just turn it over to Antoinette.
All right, so this success story is on Scott Klama and the Confederate Tribes of Warm Springs, and on the picture here is Scott Klama, and he is a tobacco prevention specialist for the Confederate Tribes of Warm Springs, and he helped the National Powwow's first commercial tobacco-free event in February this year, so it was a very big thing for them. And for Scott to accomplish this with the community, he addressed the powwow committee. He brought him information on talking points. He gave him data on surveys that he held in the beginning, and just brought a bunch of information to hope to see if he can get the community ready and on board. And bringing all this information to the committee, and the head of committee, Matthew Begay, he agreed to go forward. So before the powwow began, he raised awareness, saying that this was going to be a commercial tobacco-free event. He worked with the local newspaper and the local radio promoting this, word of mouth, and he also did a bunch of signs beforehand. He also did signs at the powwow in regulating this. So he also went to, since it was their first commercial tobacco-free event, he wasn't sure how to go about and where to start, so he got help from elders in the community. He gained additional help from other tobacco prevention specialists in the area. Also, his liaison, Tara Weston, she directed him to the Smokefree event toolkit, which was done by NARA, the Native American Rehabilitation Association, which is you can find on the Smokefree Oregon website. So he read through the toolkit and he followed the steps the way it's outlined. It has all the information and how to go in having a smoke-free event. They also have other ones for smoke-free housing, parks. And so these are just an example of a couple of signs that Scott used. On the left is the signs that he used before the event. He posts these up about a month and a half before to give the community time and be prepared to know that this is going to be a commercial tobacco-free event. At the bottom, it talks about a little bit of the reasons why and who to contact for more information and who to visit for like the website if they don't want to talk to him personally. And on the right-hand side is the example of ones that he used during the event. Again, it has information who they can come in contact with. And he also had other signs, but these are just some of the ones that were in the toolkit that you can use. So they're just examples. So he did them a little bit differently to address their tribe. So another key thing that Scott had to face was knowing the difference between commercial tobacco and traditional tobacco. Most people see a commercial tobacco-free event, they assume that it's traditional. So Scott had to stress that there is a difference between the two. And so this he pulled from the toolkit as well. So he used this as signs as well. He handed these out at the powwow so people knew the difference. He also used, handed out talking points and information on the positives of having a smoke-free event, you know, protection from secondhand exposure and things like that. So, and again, all these he was able to get from his tobacco prevention specialist that he talked to, and also in the toolkit. So part of Scott's background, he's a tobacco prevention specialist for Oregon Tobacco Prevention and Education Program, also known as TPEP. Their goal is to reduce tobacco-related illness and death. TPEP is part of the Health Promotion and Chronic Disease Prevention section in the Cancer for Prevention and Health Promotion. Back in 2008, World Health Organization, the WHO, introduced the Empower framework to prevent and reduce tobacco use. Empower is composed of 6 measures that have been applied to public health authorities across the globe. So those are monitor tobacco use and prevention policies, protect people from exposure to secondhand smoke, offer to help people quit tobacco use, warn about the dangers of tobacco, enforce policies that reduce tobacco exposure, and then raise awareness of tobacco. So the TPEP developed and took on this Empower framework and put this to use. So these are some of the things that they were working towards. And one of the big things for Scott and barriers was public readiness. So before he even decided to have a commercial tobacco-free event, he conducted a local survey to see if the public would support this, if they would be behind him. And so in doing this, it generated lots of positive feedback for Scott in deciding things. The public is ready to have a commercial tobacco-free powwow. And this is some of the information that he used and presented to the powwow committee and what got them going and agreeing with him and letting him, yes, okay, we are ready for this, we will do this. So that was one of the big key points in this. And then also from the survey that he had, there are a lot of notes that were given on there saying that they really stressed the importance of protecting getting protection from secondhand smoke, which that would come about when having a smoke-free, commercial-free event. And a couple big successes from this is that they invited the Cokeys film crew to come down and film their success of the powwow, and so they were able to show that they were able to have the powwow smoke-free, and that it also expressed the traditional side of the Confederate Tribes of Warm Springs. And then another big takeaway that happened was Confederate Tribes of Warm Springs can make a difference by taking a stand against commercial tobacco. Some of the information that Scott handed out was the definitions of the two for those who didn't know, and then and to get a better understanding of it, and then also understand the tactics that are being used by big tobacco and how they target Native Americans. So he was really able to give out a ton of information to the community that wouldn't have gotten beforehand. And so he thinks that his next step would be working on smoke-free apartments is his next big step that he's doing. And so we do have the film that Coach Cokie filmed on them, and here if you can highlight the link and you can play it. It's only about 2 minutes, I believe, but we have the video, which we can show you a little bit of it, but there's no sound, so I'll just play a little bit. You can see of the dancing and some other things like that. All right, so that was just a little tidbit of it. I really encourage you to go check it out and look it up. You can either copy the link, you can see it on the Smokefree Oregon website. It's on there. It's one of their main head points right now. And then that's also where you can also look up the Smokefree event toolkit that Scott used.
Okay, so we're definitely not taking an hour, and we knew that right off. But in closing, we just kind of hope that everything we've shared here gives you ideas. Will spur you to work with your tribes, maybe to partner and get some sponsorship. So here in the Northwest, I feel like we're very fortunate. I hope that folks on the line got some great ideas. Over time, you can see some successes. And I think the big thing, the implementation here is that we love that it goes back to the tribal community. There are community champions out there. This happens because of our folks who've been committed to working with us in the Tribal Cancer Coalition, who come to our meetings, who work with us. So we really appreciate them a lot, and we love giving the support, but it's really about the tribe, and we love that it empowers the tribe. And then here's one of our little pictures of Kiki. Again, I said the successes for us is that the events truly are community owned. The tribe plans it, implements it, evaluates it, and hosts it. And it's empowerment for the community, also getting education and making cancer prevention part of their culture. So we love that our tribes apply. And if any of you are out there and haven't applied yet, call Eric today. And then in closing, I just always like to kind of put a listing of the different things that we've had our tribes do over the years, because, I mean, I remember, gosh, it's probably in 2004 when one of our tribes did the first Papathon and Mammothon, and I thought that was like so great. And I set the stage for doing competitions with some of the tribes about like who could get the most pap smears and the most mammograms. And then we had a tribe that done the Pink Paddle Project. Tacoma Grant was our the canoe journey. They had a team in the canoe journey races. We've had tribes do the Pink Shawl, mother-daughter teas and lunches. I talked about the golf tournament. So just trying to give a listing of the different things we've had our tribes do here. And if anyone has questions about any of them, don't hesitate to give us a call. The picture down there in the corner is my staff and some of the Grand Ronde tribe, and that was the breast cancer awareness activity that happened. So the casino did an all-pink night and did breast cancer awareness, and there was honoring of survivors and fundraising, and it was very, very successful. So Eric worked hard on that bingo game for breast cancer awareness, and we're glad to share any of our resources we have here from the Northwest Portland Area Indian Health Board. And there is our contact information. The only other thing, and I don't have a slide on this, but I did kind of want to make sure we have some upcoming events. So we have a coalition meeting on June 25th that is in Warm Springs. A huge agenda. It's a partnership program. Antoinette's presenting on e-cigarettes. Eric's doing cancer survivorship. I'm going to be doing chronic disease prevention. We have our Weave project specialist, another project here at the board that's going to be presenting on nutrition. So that's our year-end coalition meeting. And then, because I wear two hats, I'm also the director for our diabetes program here. On September 1st and 2nd, we have the Nike Native Fitness training that we do here in the Northwest, which is a national training. And I'm actually going to ask Robin and Josh to post that on the National Native Network site, but it's also on our webpage. So it's an event where you come in and you work with trainers on boot camp, on fitness, on traditional kids games, and hopefully you take the curriculum home and implement it on the home front. And in addition to that, we have Daryl Tonema, who comes in and does motivational interviewing. So if you're interested in our Native Fitness, get registered, go to our webpage and get the information. And on that, there's all of our contact information, and if folks have questions, we would be glad to answer any questions. Really hard talking to a phone, by the way.
Yes, if anyone has questions, you can just type them in on the box under questions, and I'll read them off. Give it a few more minutes. Some people might still be typing. Oh, we have a question here. Can you talk more about your collaboration with the maternal and child health staff?
Sure. So the collaboration there is with a couple nurses at one of the tribes and child health programs. There's obvious connection with the tobacco cessation, the breast and cervical screening as far as women's health checks. And I think in part because of that, and in part because they're tribal members of their own tribe, serving their tribe at their health program, they have seen the impact of cancer on the community as well as their family, and really felt passionately about cancer issues. And so in addition to addressing tobacco and those screenings I was talking about, one of them had their position description written with additional responsibilities to support cancer patients at the tribe. And so with that, they have gone to patient appointments and really helped to coordinate and support communication with those patients that they're helping. So that's, I think, the connection there, and it's a very strong one because, as I mentioned, they're part of the community, and so it's not like you know, some nurse from outside coming into the clinic that's a 9 to 5 job. At 5 p.m. they're done. You know, 5 p.m. they may be going to a fundraiser. They've done numerous bake sales and golf tournaments and different things to raise funds to support cancer patients in their community.
And the state of Oregon has funding for 3 nurses in tribal programs that they support. And we're recently just starting to work a little bit with a couple of the clinics because we have very high smoking rates for our pregnant American Indian Alaska Native women here. So we're looking at a partnership with the state to do some training around tobacco cessation with the maternal child health nurses.
Thank you. We have another question. Looking for data that sheds light on cancer incidence and other diseases related to use of traditional tobacco versus commercially produced tobacco.
So with that, I mean, that sort of nuance, unfortunately, is not in the standard CDC BRFIS questions. So you're really not going to find it out of the national data. I mean, the BRFIS data I presented earlier, some of it was from the national reporting in 2008. And so that's the last time that I'm aware that it was analyzed nationally for American Alaska Natives for various risk factors. Having said that, there's opportunity with the individual tribal BRFIS to augment the questions from CDC with a question that would be appropriate and applicable to the community's usage of traditional tobacco. So it's really going to be dependent on some resources available to do a local BRFIS and to add those questions.
Okay, I don't see any more questions coming in, so thank you to Kerri, Eric, and Antoinette for their presentation. Thank you for everyone attending the National Native Network Technical Assistance Webinar. You'll see a survey coming through email probably tomorrow. You can take the time to complete that survey. It would be much appreciated. Miigwech, thank you, everybody.
All right, thanks, folks, for dialing in. We appreciate it.